Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and parliaments for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom you've been pleased to call to the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and a faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and of those whose interests you've committed to our charge. Amen. Next order.
Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Honorable members, our standing orders 210-3, it's about the budget estimates that were committed to the Budget and Appropriations Committee before the floor of this House. 3 says, upon being laid before the Assembly, the estimates shall be deemed to have been committed to each sectoral committee without question put, for each such committee to deliberate upon according to their respective mandates. Honorable members, the following sectoral committees or departmental committees need to liaise with their departments so that now they can look at the budget, and later, should there be things that they needed to raise or things that they needed to look at, they will be able to liaise with the Budget and Appropriations Chair for onward action. These are the sectoral departmental committees that you need to work with your departments in the executive. The Department of Agriculture, 2, Health Services, 3, Culture, Sports and Community Services, 4, Roads, Transport and Public Works, 5, Trade and Tourism, 6, ECD and Vocational Training, 7, Labor and Gender, 8, ICT, 9, Lands and Housing, 10, Disaster Management, 11, Environment and Natural Resources, 12, Finance, 13, Justice and Legal Affairs. Members, take note. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
There are no papers to be laid. Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
There are no statements. Next order.
Order number 8, the Nakuru County Access to Information Bill 2025, a bill for an act of County Assembly of Nakuru to give effect of Article 35 of the Constitution and Section 96 of the County Government Act by providing for the facilitation of the right to access to information and its implementation within and in the content of Nakuru County for connected purposes. First reading.
The Honorable Anthony Kanyere. You're the sponsor of this bill, and so the bill is now hereby committed to the JLAC committee for onward processing. Thank you. Next order.
Order number 9, motion.
There is a motion by the Honorable Simon Kamau, the Chairperson, Committee on County Public Accounts and Investment.
Thank you, Mr. Speaker. Sir, I rise so that on behalf of the Committee on Public Accounts and Investment, that on behalf of the members of the County Assembly Public Accounts and Investment Committee, I beg to move the adoption of the report of the committee on the report of the Auditor General on the financial statements of Njoro Level 4 Hospital of Nakuru County Government for the year that ended 30th June 2022. Mr. Speaker, Public Accounts and Investment Committee is a select committee established under the Standing Order number 188 and is responsible for the examination of the working of public accounts and investments. Mr. Speaker, the mandate of the committee is as follows. 1, the committee is supposed to examine the accounts showing the appropriation of the sum voted by the House to meet the public expenditure and of such other accounts laid before the House as the committee may think fit. Number 2, examine the reports and accounts of the public investments. Number 3, examine the reports, if any, of the Auditor General of the public investment. Lastly, examine in the context of the autonomy and efficiency of the public investments whether the affairs of the public investments are being managed in accordance with the sound financial or business principles and prudent commercial practices. Mr. Speaker, the committee is comprised of the following members. 1, we have Honorable Simon Kamau as the chairperson, Honorable Michael Jenga, Honorable Samuel Ngarama, and of course the list goes all the way to Honorable Member number 13, Honorable Gadoita Mwangi. I believe the honorable members have the same in their gadgets. Mr. Speaker, in the execution of our mandate, the committee experiences some of the challenges, and some of these obvious challenges are, 1, that the members noted time and resources that are allocated to the committee is too little in comparison to the workload. But again, Mr. Speaker, I want to thank you and the office, or your office, because we deliberated on this, and of course we agreed on the way we are going to work going forward. Again, another challenge, Mr. Speaker, is that some of these reports that of course we bring to this House, they are supposed to be implemented, and they are supposed to be implemented by the implementation committee. So I want to challenge the Chairperson Implementation Committee to ensure that some of the observations and recommendations that are put forward by this committee are implemented. Otherwise, if this does not happen, then even some of these entities will not see the seriousness of some of the observations that are made by the committee as well as the recommendations. So therefore, I'm employing on the implementation committee that is led by a very able member of County Assembly from Turi, Honorable John Mwangi, to ensure that the recommendations that we put forward, of course, are implemented. And it is good that I'm still in that implementation committee. So I'll put Mheshimiwa John Mwangi on toes so that the recommendations of the Committee on Public Accounts, of course, are taken care of. And of course, I know under your guidance, this is going to happen because it is a challenge. Sometimes, at some point, Mr. Speaker, sir, I overheard somebody saying, there is nothing that is going to be done by the County Assembly. We don't want such languages to emanate maybe from some entities because it shows somebody somewhere is not doing what he or she is supposed to be doing. So those are the two major challenges that are facing this Committee on Public Accounts. Mr. Speaker, on the committee proceedings, the committee held the sittings in which it closely examined and had evidence from the management of Njoro Sub-County Level 4 Hospital in its inquiry into the audit response of the Njoro Sub-County Level 4 Hospital for the year that ended 30th June 2022. The committee had and revised both oral and written evidences from the management. Of course, the records for the evidence adduced, documents and notes received by the committee form the basis of the committee's observation and recommendations as outlined in the report and can be obtained in the Hansard report of the committee available in the County Assembly of Nakuru if need be. Objective of the committee is these observations and recommendations, if taken into account and implemented, will enhance accountability, effectiveness, transparency, efficiency, prudent investments, and financial management in all the level 4 hospitals in the county government of Nakuru. Mr. Speaker, it is good to note the reason as to why we are saying this. Some of these challenges that, of course, are faced by this particular facility that is in Njoro Level 4, it is almost cutting across all the Level 4 hospitals within the county government of Nakuru. If at all, some of these recommendations and observations are put into consideration and implemented, then some of these gaps, of course, can be closed. Mr. Speaker, some of the major issues that were highlighted by the Auditor General were, for example, one, we have a report on the financial statements. Of course, I'm going to give the details for the same. Number two, the report on the lawfulness and effectiveness in the use of public funds and resources. Number three, report on the effectiveness of internal control, risk management, and governance. And in summary, we are saying there is inaccurate in total assets and liabilities. I'm going to give this in details in due course. Number two, there is also another reason as to why this particular report was put under qualified opinion, and that is non-disclosure of property, plant, and equipment. Number three, and the last one for this case, is that there was unconfirmed inventory balance. Mr. Speaker, to start with the first one, that is inaccurate total net assets and liability, the audit committee in the said facility could not be able to explain the difference in whatever they were showing in their financial statements and whatever was put forward by the auditors. There was a discrepancy of over 2.6 million shillings. And of course, we noted as the committee that this is a problem that, of course, is in the office of the accounts. And of course, this one showed incompetencies in some of these personnel who are working under the accounting units in some of these facilities, and to be more specific, the Njoro Sub-County Hospital. A discrepancy of over 2.6 is not a small margin, of course, considering the size of that particular facility. The committee on this discrepancy had the following observations. One, the management failed to explain before the committee the variance amounting to 2,668 shillings, 2,668,240 shillings to be specific. So they were not able to explain. And the good thing is that these people, the management of Njoro Sub-County Hospital, of course, they are concurring with the report of the Auditor General. So therefore, they confirmed to us as the committee that there is a problem within their accounting office. And of course, they promised they are going to rectify this. And we told them, if at all these accounting officers are not competent, then they need to replace them, because we cannot keep on having such discrepancies. So, again, the committee recommended the following. One, that the management should rectify the discrepancies between the statement of the financial position and the statement of changes in the net assets by ensuring that all capital funds and other balances are accurately reflected in the financial statement. Mr. Speaker, another query, as was put by the Office of the Auditor General, was the variances in revenue from rendering medical services. And of course, out of the total amount of slightly over 24 million, there was money that was in question, and this one was the money that was supposed to be given back to the facility by the NHIF. The money that the NHIF had said that they had rendered back to the facility was 10,285 shillings, 715. But of course, what was contained within the documents of Njoro Sub-County Hospital was 9,907,980, therefore giving a discrepancy or variance of over 377,000. This might sound a small amount, but of course, for those who knows Njoro, because this is where we come from Njoro Sub-County, we understand at least how that facility is and its size and its operation. This amount, 377,000, is quite a lot of money, of course not being explained where it is. Of course, it is going to affect some of the services within that particular facility. So there was a discrepancy of 377,735 to be specific. On this, the committee made the following observations. One is that the variance of 377,735 was noted between the National Health Insurance Fund, that is NHIF, reimbursement records, into bracket 9,907,980, and the reported amount of 10,285,715. In short, what the management was doing was to confirm that there was an error that led to the variance of 377,000. Number two, another observation that was made by the committee is that the accuracy and the completeness of the medical services income could not be confirmed. And on this, the committee had the following recommendations. One, the management should reconcile, specifically the accounting unit, should reconcile the NHIF reimbursement records with the financial statements to ensure that the revenue reported is complete and accurate, and provide supporting document for all the transactions. Number two, another recommendation is that a progress report of the reconciled balances to be availed by the hospital management to the committee, and of course we gave a deadline, that is 30th June 2025. And of course, as a committee, we will ensure they come and of course give us the progress report, so that of course we do and we act at the same time. If they will not have done what we told them as a committee, then the committee will decide on what to do, or what to, of course, we will guide on what we are supposed to do to the House and to the management of Njoro Sub-County Hospital. Number three, another query that was put forward by the Office of the Auditor General is that there was non-disclosure of property, plant, and equipment. Of course, in their financial statement, Mr. Speaker, sir, is that they showed the total amount of money in their financial statement was 2,460,173 shillings. This was what was recorded in their financial statement. But of course, After the auditor visited that particular facility, there were so many other things that were not recorded, of which, if recorded, automatically could have led to increase in the figure that is indicated here. Of course, that particular facility has got land. Of course, to be specific, they are saying it's approximately 7 acres. And of course, the value per acre in Njoro maybe can go to slightly over 2.5 million. Therefore, if that money was included in their financial statement, automatically it could have led to the, of course, increase in this amount. And not only the land, we still have the buildings, and of course we are going to see exactly what is there because we still have an incomplete facility that is taking place. It could have also increased the amount. We have got vehicles, we have got furnitures, we have got computers, and of course other equipment. All these, they were not included. But the reason as to why they did not include this, of course, they said there is a problem with the valuation. And of course, this one is going to be attached to another particular department. We are going to mention it maybe along the way, that of course is sleeping on its job. That is why some of these statements cannot be complete, and not only in Njoro, it is in almost all the facilities, because somebody somewhere is joking around with his or her job. Then, observations for the same, the committee made the following observations or findings. One, the financial statements reflected a property, plant, and equipment balance of 2,460,173, but several assets, including lands, buildings, vehicles, and medical equipment, were not disclosed. Number two, the committee noted that the majority of the hospital's land was either donated or was from the defunct county council. As a result, the hospital does not possess the title deed. And to be specific, the land where this particular facility is sitting on was donated by the Catholic Church of Nakuru. And of course, that is why we said they have to do something, or the Department for Lands has to do something, so that at least some of these facilities can, of course, claim ownership. Because if they don't have title deed, of course, that land does not belong to them as per se. It belongs to the CDN, Catholic Diocese of Nakuru. That is why we are saying, and we are employing for the Department of Lands to, of course, make sure there is something that is being done to ensure, of course, some of these facilities claim ownership. Because, Mr. Speaker, sir, some of these facilities, they can be in good terms with the person who donated the land today. But tomorrow, it can be a different case altogether, Mr. Speaker. And of course, some of the facilities that are being put here, of course, they cost a lot of money. Njoro, to be specific, it has a facility, an incomplete, of course, hospital that is maybe outpatient and inpatient wing that is costing slightly over 147 million. So if Catholic Diocese of Nakuru today says that it wants its land back, then you can see the kind of loss, Mr. Speaker, that we can get as maybe as a county. And that is the need, of course, for these particular documents to be availed to the facilities. Committee recommendations on the same. One, the management should ensure that all property, plant, and equipment are accurately disclosed in the financial statement with the supporting documentation, such as valuation reports, asset registers, and ownership records, particularly for lands and buildings. Number two, and I think this is where the problem is, that the CCM and CO, Department of Land, should expedite the process of valuation so that the hospital gets title deeds for the land. And Mr. Speaker, I think we said as a committee, when we are inviting the CCM lands and the CO lands, we also need to invite the CC and the CO health so that we avoid all these departments shifting blames to each other. So we are going to call them as a committee, and of course we say that this recommends that a progress report from the departments to be availed to the committee by 30th June 2025. Another audit query, Mr. Speaker, is that there was variances in receivables from exchange transactions. And of course, this was just like the same as the other one, NHIF. It is dealing with NHIF as well. And of course, this one was showing a discrepancy or a variance of slightly over 6 million. Again, what is in the record of the NHIF offices and what is in the record of Njoro Sub-County Hospital, there was a difference. One was showing 12.5 million, another one was showing 6.1 million. Therefore, there was a discrepancy of slightly over 6 million. On the same, the committee made the following observation. One, the committee noted that the financial statements reported receivables of Kenya shilling 12,553,248, while NHIF records indicated 6.1 million. And therefore, there was an explained variance of slightly over 6.4 million. The committee recommended the following. One, the management should reconcile the discrepancies between the receivables reported in the financial statement and the NHIF records and provide a comprehensive aging report for all the outstanding receivables. Number two, the reconciled records should be availed to the committee by the company management by 30th June 2025. Mr. Speaker, another query that was put forward by the Office of the Auditor General was what I have just mentioned, that is the delayed completion of the outpatient and inpatient block. There is this particular block that is costing slightly over 147,553,940 that is not complete to date. And of course, it started sometimes in 2021. That is about 4 years down the line, and of course the block is not complete. Therefore, automatically, the reason as to why, as a committee, we recommended that this has to be done. Because when this facility came up, of course it came up as a result of public participation, and of course there was a need. And the community within Njoro Sub-County, and that is where we are with Mheshimiwa Wanjoi, we found that of course our clients or our residents from where we come from, they are, of course, using a lot of money and, of course, a lot of time being transported from, for example, from Rale to Nakuru, from Kiingo to Nakuru, from Mau Narok to Nakuru, from Mauche to Nakuru, from Naiswet to Nakuru, and sometimes even from Njoro itself to Nakuru level 4 hospital, level 3 hospital. Of course, there was a need to bring up, to come up with such a facility so that at least we shorten the distance for the patients, as well, of course, the money that they use maybe being transferred from those areas to Nakuru. And of course, there was a need. And that is why we are saying it is a concern if this particular facility is not complete. Of course, it needs to be completed so that at least the services can be provided there. So, as a result, the committee had the following, or found the following. One, the construction project for the outpatient block, which began in February 2021, has not been completed and is estimated at 70% completion as of April 2024. Number two, ownership documents for the land on which the block is being constructed were not provided to the committee. And of course, they don't have them. It was not provided to the committee simply because they don't have them. We asked them whether they had left them in Njoro so that at least we could send somebody back to come with a said title deed. But of course, they did not possess some of these documents. And it is very risky, whereby we have a facility that is over 147 million, but of course you don't have the ownership documents. Then committee recommended the following. One, that the accounting officer, that is the Department of Medical Services, Public Health and Sanitation, to fast-track completion of the stalled project, and a report on the same be availed to the committee within a period of 90 days upon adoption of this particular report. Another audit query that was put forward was the irregular engagement of casual workers, and as per the law, the County Assembly of Nakuru Public Service Board, that these people are supposed to be engaged on short-term cashiers. But this was not the case, because when we were scrutinizing the documents that were brought by this particular management, of course, we saw there were some cashiers that were involved for more than 3 months. Of course, that was going against the County Public Service Board. And over the same, the committee had the following findings. One, the cashier workers were engaged for periods longer than 3 months, which is contrary to section B16, subsection 1 of the County Public Service Human Resource Manual. Number two, the management was in a breach of the same law, or the said law. And the committee recommended the following. One, that the management should adhere to the County Public Service Human Resource Manual and ensure that the cashier workers are engaged for urgent, short-term tasks only, and for the periods not exceeding 3 months, unless there is prior approval from the County Public Service Board. Mr. Speaker, another concern, and I think this one was put forward by the national government, that of course some of these hospitals, if not all, they are supposed to provide universal health coverage. But of course, in the process of implementing the same, of course, there are some things that have to be put into consideration, and that is maybe the human resource as well as some of the equipment. This one, for it to be complete or efficient, there are some requirements that are put forward, but of course, they are not there in Njoro Sub-County Level 4 Hospital or anything that is near maybe what is required. For example, maybe I can bring this maybe closer home. We are saying that the medical officers, Level 4 Hospital is supposed to have at least 16 medical officers, but now how many are in Njoro? We have only 1 medical officer. Therefore, we have maybe a difference of 15 medical officer. That is translating to about 94%. Maybe, Mr. Speaker, sir, you can try to imagine maybe the kind of services that is supposed to be rendered by 16 medical officer, and it is only left to 1 medical officer. That it means automatically at some point, some services has to be affected. We don't need rocket science to know that some of the services within Njoro, Level 4 Hospital, are compromised. Again, general surgeons, for example, we are supposed to have 2, but we have 0. So it means the services that are supposed to be provided by those surgeons are not maybe provided in Njoro. Gynecologists, they are supposed to be 2. We have none. Pediatrics, they are supposed to be 2. We have none. Radiologists, they are supposed to be 2. We have none. Kenya registered community health nurses, we are supposed to have 75, but we have only 10. Maybe there is a variance of 65 nurses. Mr. Speaker, that is on the side of the human resource. On the equipment, now, resuscitator, they are supposed to be 2 in number. Then, at least they have 2. Then, that one at least they have. But of course, newborn unit incubators, they are supposed to be 5. They have nil, they are supposed to, and the list continues. So going through the list, and of course, as well as the human resource, you can be able to tell that there are so many services within Njoro Sub-County Level 4 Hospital that are compromised, Mr. Speaker. On the same, the committee made the following findings. One, the hospital was understaffed in key areas, negatively affecting the service delivery. Number 2, Mr. Speaker, that the hospital lacks equipment and infrastructure such as ICU beds, dialysis machines, and essential medical equipment. These deficiencies, these of course are affecting service delivery negatively. And on the same, the committee recommended that the management should collaborate with the County Public Service Board to address staffing deficiencies and work with the county and national government to procure and install the required medical equipment to meet the universal health coverage standards. On this one, maybe I would also request the House, through the Chairman, Committee on Health, that if those people, that is the County Public Service Board, and of course the Department of Health, if at all they require a budget, it is only us, as the honorable members, who can provide the same. Because at some point, Mr. Speaker, we cannot be demanding that these people, these personnel, be installed in these facilities, whereas the Public Service Board does not have the budget, the Department of Health does not have the budget. Maybe I would request through our able chairman of the Committee of Health, if at all they need the said department, the department as well as the Service Board, if they require a budget, it is through this particular house that, of course, they are going to have the budget, so that if the equipment, if they need the equipment, they can buy using the same budget. If it is the issue of staffing, of course, it can be sorted through this assembly by providing the required budget to the Department of Health generally. Mr. Speaker, there is also another serious one here, and of course that is the stockouts of essential medical supplies. Mr. Speaker, the statement of this financial position reflects an inventory balance of 2,900,000 as disclosed in particular financial statements. Of course, a review of the hospital stock cards for controlling stores indicated that the hospital experienced stockouts of medical supplies ranging from six days, maybe all the way to 363 days. So it means at some point, all the year round, sometimes some of these stocks were not there in Njoro Level 4 Hospital, which is very dangerous. By the way, Mr. Speaker, I happened to take maybe one of the patients there, sometimes at 3. And of course, you can tell, and not only at 3, even during the day and during the evening. Some of these patients, they are being sent to buy medicine outside, including paracetamol. So there is a serious challenge, and I can see Mheshimiwa Njoro here, who is the Chairman Health, needs to look at the issues, what is happening within Njoro sub-county, because of course they are out of stocks in most of the times for the very basic drugs, including paracetamol. Mimi mwenyewe, Mr. Speaker, I had to buy. And again, something else that maybe I want to bring to the attention, though it's not contained in this particular report, is that this facility, of course, is making the patients to pay money, cash. On the doors, on the windows, Mr. Speaker, sir, they are saying that you are not supposed to pay any cash. But of course, I was a culprit myself, because I had to pay some amount for this particular client. So they should preach water and take water, not preach water and take wine, because that is happening in Njoro sub-county. And it is good, Mr. Speaker, that I can be able to see our able chairman, Health, is here, so that he can take note over the same. Number 2, the hospital was unable. So as a result, the committee had the following findings. 1, the hospital experienced stockouts of essential medical services, that is ranging from this day to this day. I think I had said this. Number 2, the hospital was unable to provide sufficient quantities of necessary medical supplies, which could potentially hinder the delivery of quality health services. And because of the same, the committee recommended that the management should improve its budgeting process to allocate more funds for medical supplies and optimize procurement practices to avoid stockouts. Number 2, the management should implement a more efficient inventory management system to ensure adequate stock levels of essential medical supplies are maintained at all times. Mr. Speaker, those are the major audit queries that were put forward by the Office of the Auditor General, and of course, we discussed this in length with the management and the Committee of the Public Accounts and Investment within the Assembly. In conclusion, Mr. Speaker, the committee, after a thorough review and discussion of the Auditor General's findings, acknowledges the overall effectiveness of the internal controls, risk management, and governance systems at Njoro Level 4 Hospital. While there are areas requiring attention, such as the non-disclosure on inventory balances, long outstanding NHIF claims, and non-compliance with specific financial and operational regulations, the hospital's management has demonstrated a willingness to improve and address these concerns. It is evident that the hospital is working towards enhancing transparency, accountability, and the proper management of public resources. The committee recommends that management continue to act on the audit findings, ensuring that the necessary corrective actions are implemented to promote financial integrity and operational efficiency. Mr. Speaker, the committee has the following acknowledgement. The committee extends its heartfelt appreciation to all its members for their dedication, hard work, and unwavering commitment to ensure transparency, accountability, and good governance within Njoro Sub-County Hospital. Each member's contributions, insightful analysis, and collaborative efforts were essential in thoroughly reviewing the Auditor General's findings and formulating comprehensive recommendations. Your collective expertise and constructive engagement throughout this process have been invaluable, and we are grateful for the time, effort, and professionalism each of you has shown in fulfilling our mandate. This collaborative spirit ensures that we remain focused on our shared goal of improving the hospital's operations and service delivery to the benefit of the community. We sincerely appreciate your continued commitment to public service and the betterment of the health sector in Nakuru County Government. The committee again extends its sincere gratitude to the Speaker of the Assembly and the Office of the Clerk for their unwavering support throughout this process. Your leadership and commitment to ensuring good governance and accountability have been invaluable. We also acknowledge the management of Njoro Sub-County Hospital for their cooperation during the audit process, for providing the necessary documentation and responses to the Auditor General's findings. We appreciate their ongoing efforts to implement measures aimed at addressing the identified gaps and ensuring improved service delivery. Lastly, we recognize the important role of the Auditor General's Office in providing an objective and comprehensive assessment of the hospital's operation. Their detailed report has been instrumental in guiding our recommendations and ensuring that the hospital's operations remain in line with the statutory and regulatory requirements. We look forward to continued collaboration to ensure continued success and improvement of Njoro Sub-County Hospital in the years to come. Thank you, Mr. Speaker. Maybe I want to request Mheshimiwa Sakwa from Kivumbini to second the said motion. Thank you, Mr. Speaker.
The Honorable Sakwa.
Thank you, Mr. Speaker, sir. Maybe just riding on the report that the chair has given a detailed report. That's what we were handling during the committee level. Just one area of the concern, Mr. Speaker, sir.
Honorable Neto Sakwa.
Yes.
You invited to second, not to deliberate or discuss the motion.
Thank you, Mr. Speaker, sir. I second the motion, but just on the same line, if you could donate to me 1 minute. Okay, thank you, Mr. Speaker, sir. I was just riding on the statement by the chair when he was giving the report, that implementation part of this report is very essential, one to the committee and to the whole house, because Njoro Sub-County Hospital does not operate in isolation. Some of the reports that will be coming to this house will be having the same findings, the same observation and recommendation from the committee, because the same reports will be, maybe the facility lacks title deed, maybe the staffs that should be offering the services, their number is less, so the management cannot run the hospital efficiently. And then most hospitals lack stockouts for essential services to be offered to the same hospital. So implementation part of this report should be fully implemented. Thank you, Mr. Speaker, sir.
I now propose the motion that this House adopts the report of the committee on the public accounts and investment on the Auditor General's report on the examination of the financial statements of Njoro Level 4 Hospital for the year ended 30th June 2022, laid on the table of the Assembly on Tuesday, 15th April 2025 during the morning sitting. The motion is open for debate. The honorable member from Elbagon.
Thank you, Mr. Speaker. Mr. Speaker, I'm in record before, and even today I'm going to repeat, that the ownership of lands need to be known of all the public entities that we have as a county, or as a county government of Nakuru. Mr. Speaker, I've heard the chairperson of PAC alluding that that land belongs to, or rather it used to belong to Catholic. But on the ground, Mr. Speaker, also there are different stories and different information that that land belongs to Njoro Golf Club. That's where that land came from, Mr. Speaker. And however, we need that the county government to reconcile itself and to give that facility the proper ownership documents, so that, Mr. Speaker, in tomorrow, there will be nobody who actually is going to claim the ownership of that land. Mr. Speaker, we live in a country whereby other public grants, all of them, have been converted to private benefits, or rather they are going to private hands, Mr. Speaker. And without that land being given the title deed, maybe in the future, Mr. Speaker, we're going to find some of the members here being owners of the land that belongs to that Njoro Hospital, Mr. Speaker. Also, there is a lot of encroachment there, Mr. Speaker. There are some members of the public who have encroached into that land, and therefore we would wish that that process to be expedited so that that facility can have a title deed. Mr. Speaker, also on the expiry of the drugs, there need to be a proper systems, and we are going to take up onto that matter together with the Public Health Department to make sure that the drugs that have expired from those facilities, as they are claiming, have a channel of recording and also of coming up with the proper data onto how even those drugs are going to be disposed, to avoid some issues whereby that facility can be hiding itself from its responsibility, and they keep on, blaming the smaller facility because the auditors don't go to those small facilities. Also, Mr. Speaker, I would wish to raise a concern and to say the systems that were used to accredit Njoro facility as a level 4 were long. That is not a level 4 facility. That is a high volume level 3 facility. And there are others, Mr. Speaker, of the same nature. That's why we have 1 medical officer, 2 clinic officer, 10 nurses. And you see, Mr. Speaker, as per the WHO, there are the set guidelines that a level 4 should have 16 MOs, whereas we have 1, just because that facility is a level 3. And therefore, Mr. Speaker, I would wish to request, Mr. Speaker, but now that this matter, though the chairperson said it should be committed to the implementation, we would wish also as a committee of health to have a pie of the same, so that we can be able to go into details and return that facility to where it belongs, at level 3. And we have many of them, Mr. Speaker, with the same nature and the same problems, and therefore we would wish to say that we'll be inviting the department so that they clarify why did they accredit a small facility to such levels. That's why they are having some audit questions and audit queries. Mr. Speaker, also on the issues of uncompleted building that is there. Mr. Speaker, we know by now the Njoro facility should be using the new building. Plus others like Njoro and other of Elbagon and the rest, Mr. Speaker. But so far, that issue, because it have come and it have been raised by the Auditor General, there is a concern. And these issues should be followed up with urgency so that we can have the value for the money. Mr. Speaker, there is no need for us to construct a building and then we are going to use those buildings after 10 years. We are not going actually to cure or to arrest the challenges that those facilities are going on. Therefore, Mr. Speaker, I would wish to support the report and request all key stakeholders, all the committees that have been mentioned, or rather they have some issues as far as that facilities is concerned, they should take up those matters and assist in implementation so that at least that deliberation can bear the fruits of rescuing that facility. I beg to support.
Thank you. As a member for Nakuru East, the Honorable Kanyere.
Thank you so much, Mr. Speaker. I stand to support this report. Mr. Speaker, sir, this committee of PAC deals with investment and accounts, and I can see ourselves dwelling so much on the investment part. And there are some elements of accounting that have been mentioned in this report which need to be addressed, Mr. Speaker, sir. There are some variances of monies, 2.6, 377, there is 6.4. Somebody has to take responsibility for that money. Mr. Speaker, sir, as we were starting this session, you reminded us that the budget estimates were tabled in this House, and you even directed us as committee members to sit down with the relevant committees. I want to urge members of this honorable House, as we sit down with the committees, let's put these matters of accountability into perspective, because we are dealing with money, we are dealing with investments, and we are going to appropriate money in the next financial year. And Nakuru people, they are supposed to get value for money. So, Mr. Speaker, sir, I want to urge each and every member in the relevant committees that we are sitting, let's put the members of executive to account for what we have appropriated. Mr. Speaker, sir, the issue of land ownership, it is now the third year I'm hearing this issue. As we sit down with these committees, let's put some ultimatums for the committees like the Land Committee, the Education Committee, Health Committee. For them to get money, they need to put their house in order. And one of the issues that they are supposed to put in order is to get ownership. We cannot continue putting money, pumping money as public investment, and we stand a risk of losing this investment. It has been mentioned by two different reports. The chairman Park said that the land belonged to the Catholic. It was donated to the county government. The chairman Health said that the land belonged to the golf club. So you see the risk that we are sitting on, Mr. Speaker. So I just want to urge members, let's be serious on the matters to do with budget allocation, because these are monies that have been tasked to Kenyans, and we have to get value. And we are just here for a season. You don't know, tomorrow people will come, as it has been mentioned, and all these investments will go down the drain. So, Mr. Speaker, sir, that is my take as I support this report. Thank you.
The Honorable Member for Amalo.
Asante sana, Speaker. Thank you so much. First of all, let me take this opportunity to thank the committee for a very brilliant task. Mr. Speaker, sir, as stated by the chair, I think most of these hospitals have almost uniform challenges. As the chair said that in our county, we are one level 5 hospital and around 13 level 4 hospitals, which are almost the same. Mr. Speaker, sir, I think when we go through the challenges, ranging from lack of staff to lack of equipments, and many other things which are almost similar across our county. As earlier on stated by our fellow Wishimua, we have a lot of unfinished business in the health sector. There are other issues, Mr. Speaker, sir, like the remittance from the defunct NHIF, which, Mr. Speaker, we believe that SHA or she will address those issues. As we go forward, Mr. Speaker, sir, there are issues stated by the Chair L that needs to be stories of long time ago. The stories of title deeds. In this time, we are not supposed to be talking about a facility without an ownership. Most of the facilities across are lacking ownership. As said, there are a lot of encroachment on these properties which are supposed to be safeguarded by the county. Finally, Mr. Speaker, sir, there are raft of recommendations highlighted by our committee, which, if we can follow it step by step, we will really address the mess and challenges in our health department. So, Mr. Speaker, sir, I second the report. Thank you so much.
Thank you, the Honourable Member from Amala. The Minority Whip.
Thank you, Mr. Speaker. First of all, I would like to commend and appreciate the work done by the Park Committee. Of late, they've kept the House busy with the so many reports they are coming up with. I do congratulate you, Mr. Chairman, and your team. Continue with the good work. Mr. Speaker, in their report, or the auditor's report, we see that the Njoro Hospital has been engaging cashew workers for more than 3 months. This is a breach of law, Mr. Speaker, and this is what is causing our county so much in legal battles, because if a cashew worker works for more than 3 months, that means he or she is entitled to permanent employment by the county. So it's upon the ministry, and right now, because we are employing, and I know people are, so many have nurses, clinic officers, they've done interviews. The ones who have been working in Njoro as cashews, Mr. Speaker, we expect them to be engaged in longer contract terms. Mr. Speaker, there is also the money from, which was the debt from NHIF, which has now gone to SHA. Mr. Speaker, I expect this department to fast track and make sure the hospital gets its rightful share. It's a sub-county hospital, and why we have level 4 hospitals in sub-county, Mr. Speaker, is to make sure that we decongest our referral hospital. Mr. Speaker, I support the report and the motion, and we expect, I sit in the health committee and I sit in the implementation committee. I hope the chairs will take up the matter, and we make sure that we help each other. We are here as committees, all the committees, to keep on supplementing each other so that our county can move forward. Thank you, Mr. Speaker, sir.
Thank you. The Honourable Member for Lakeview.
Thank you, Mr. Speaker. Mr. Speaker, I would want first and foremost to register my appreciation to the Committee on Park and also the Committee on Health, because of the many reports that have been generated within this assembly, reports that impact on the people of Nakuru positively. And more so, Mr. Speaker, when I look at the report that has been read upon here by the Park Committee, mainly touching on Njoro. The earlier speaker, the minority whip, has stated very well that all the casuals that had been given contracts 3 months, these people should be absorbed. And I want to hail Her Excellency and the administration that of recent we have had interviews going on within Nakuru County, and my first thing or recommendation would be that all the people who have been under contract should be absorbed within the system, because they have done good work within the time that they have been there. Mr. Speaker, matters to do with title deeds or titling within our hospitals has also been touched here. And it is so antagonizing that we have major hospitals within Nakuru and we don't have title deeds to such facilities. It is not the failure of the current regime, Mr. Speaker, but this is a problem that has been brought forward from previous regimes to the current regime, Mr. Speaker. And I know Rome was not built in a day, that we can solve these problems at once. Mine is just to ask the CCM runs, Honorable Kihagi, to go with speed and ensure that at least within this regime of Her Excellency Susan Keheka, we have had title deeds being given to our facilities, and not just the hospitals, Mr. Speaker, even the ECDs that we have within our region. In my own place, Mr. Speaker, I have land for the ECDs, but we don't have the title deeds for that, for such facilities, Mr. Speaker. Mr. Speaker, mine is to commend the House for such a good debate on this issue as we forge ahead to see the county prospering. Thank you very much, Mr. Speaker. I support.
Thank you. The Chair, do you want to respond?
Thank you, Mr. Speaker, sir. I have only a few issues that have been put forward by the honourable members, and I want to start with Mheshimiwa Njuguna, who is the Chair Health. The issue of ownership. Of course, there is nothing that we are supposed to debate on the same. The relevant committee of the the relevant department, of course, should take up this matter, and of course sort this mess. Mr. Speaker, I'm surprised that Mheshimiwa Njuguna has a different version, all the same. But of course, we as the committee, we have to depend on what was provided to us by the Njoro management. And of course, they told the committee, and I was here, of course, they said that the ownership, the previous owners of that particular piece of land was the Catholic Diocese of Nakuru. Hearing of something different, that is why we are saying it is very important, of course, to establish the real owners, or to be provided, not even the owners, the current owners of these particular lands to be provided with the ownership document. So whether it was the golf club or the county CDN, they need now, the Njoro Sub-County Level 4 Hospital need now to have that ownership document. I want to agree with Mheshimiwa Njuguna that, of course, that land where Njoro Sub-County Level 4 Hospital lies, of course, has been encroached. And again, this is a mess, Mr. Speaker, sir, that is going again to be sorted by the same department for lands, when, of course, they are providing the title deed, because even the size of the land, the title deed is going to heal this particular problem. The expiry of drugs, again, that is an issue that, of course, has been put forward by the Auditor General, and Mheshimiwa Njuguna, of course, has confirmed. But one thing that I want, of course, to establish is that whether all these, because these small facilities, as the management was saying, I have one said small facility in my ward, and of course they have their own ways of course, exposing these particular drugs. Something we need to establish, and of course we said as a committee, we are going to pay a visit to this particular facility. We establish the facts in as far as this expiry of drugs is concerned. The issue is a huge one, and of course it needs to be addressed. Again, this cannot be left to the Committee on Public Accounts only, because sometimes we depend on the report of the Auditor General. Sometimes this one needs to be taken up by the Committee on Health, because at least they can be able to visit this particular facility anytime to establish these facts. So that is why we are saying the committees has to work together, so that now this ball, I threw it back to the Committee on Health so that they can be able to establish this issue of expiry of drugs. Again, as Mheshimiwa Njuguna has said, this is the Committee on Health that is supposed to advise this House where this particular facility belongs, whether it belongs to level 2, 3, or even 4. It is the work of the Health Committee, and of course I'm happy that Mheshimiwa Njuguna has taken up that matter to place Njoro Level 4 Hospital to where it belongs, because we cannot keep on, Mr. Speaker, sir, calling a facility level 4, whereas it has one medical officer instead of 16. Then it needs to be degraded as soon as now. And of course, Mheshimiwa Njuguna is going to take up on this. Incomplete project, as Mheshimiwa Njuguna said, and I want to agree with him, and it is the view of the committee again. This one, there was a reason as to why this particular project was brought forward. Now, being incomplete for more than 4 years, then it means what its intended purpose, of course, is not realized. And we need to do it as soon as now. And I believe a budget for the same has been provided so that at least we can be able to complete. It is like, for example, now I put money to build a class, and by the end of the day, I'm not going to put furniture in it, and we are not going to provide personnel in that particular structure, then it means we have wasted that money that we have used to build that particular house, because that one cannot be referred to a classroom without the furniture, without the boards, without even the teacher himself or herself. Then it means that there is no value for the money. It is the same with this particular project. Being incomplete, and of course, because we normally maybe pay a visit to that particular facility, there is nothing that is going on in this particular facility. And of course, Mr. Speaker, as the auditor said, of course, it is 70% complete, only 30%, and of course, we make it running. So it needs to, something needs to be addressed in as far as that one is concerned. The issue of accounts, I think Mheshimiwa Kanyere, we had mentioned about the discrepancies or the variances that are there in as far as the accounts are concerned. And I want to agree with Mheshimiwa Kanyere. We cannot just be talking about figures here. Somebody has to be made responsible for the said figures and for the said variances, because this is where corruption is in these particular accounts. And we believe, because Mheshimiwa Kanyere normally comes to my, and I want to thank him, because of course, Mr. Speaker, he is very helpful in my committee. We have to grill these people. And of course, we ensure, if there is a discrepancy in as far as accounting is concerned, somebody must be held responsible. Therefore, I want to agree with Mheshimiwa Kanyere. Again, I don't want to overemphasize on the issue of land ownership. It has been mentioned by Mheshimiwa Kanyere, Mheshimiwa Njoro, Mheshimiwa Langat from Amaru as well. This is an issue that needs to be addressed. Then we have the minority whip, that is Mheshimiwa Virginia from Hellsgate. The issue of cashiers. This is an issue that needs to be addressed, and I want to agree with her, because at some point, as she has said and correctly put it, is that we can have legal battles here and there. And if we have legal battles, then of course it comes with implications. And of course we know it is financial, Mr. Speaker, it is financial implications. This money that of course is going to be set to the office of the county attorney to deal with such issues, where some people have breached the law and the law has been put in place for them to follow. Only them to breach the law and of course to increase the financial implications. This money that ought to go to the county attorney can go to somewhere else. We can even facilitate even buying more drugs to these particular facilities, or even taking, maybe increasing the amount of Uji in these ECDs. We don't want to take money for our own ignorance. We need to avoid that, Mr. Speaker, and therefore I want to agree this issue of cashiers, and I want to agree with Mheshimiwa Alex from Lakeview. Of course, these people who have worked for more than, if there is job that they are supposed to do, then if they are working for more than 3 months, then, Mr. Speaker, it means there is something that these people are doing on the ground, and therefore they need to be absorbed as soon as possible, so that at least we can be able to avoid the legal battles. And of course, I want to thank Her Excellency, just like Mheshimiwa Alex has said, of course, for agreeing to absorb these casual workers, so that at least they can be able, the issue has to be sorted out. But again, Mheshimiwa Alex, maybe to finish or to conclude, Mr. Speaker, yes, the issue of land ownership was not corrected by the previous regime. But of course, we cannot blame the previous regime. Of course, the current regime is the one that is supposed to deal with the issue of the land ownership. So if it is dealt with the current regime, and I believe Her Excellency the Governor is equal to the task, and that is why we are imploring for those people whom have been placed in those particular offices by Her Excellency the Governor. The Governor did put them in those offices because she knew that those people are equal to the task. That is why we are demanding. We are not even requesting. We are demanding those people who are in those offices, specifically the CCM lands and the CO lands. Yes, we want, of course, to ensure we put them to task and ensure that they sort this mess out, because, of course, it is a big one. Otherwise, Thank you, Mr. Speaker. Thank you, honorable members, for supporting me. Thank you very much.
Now I want to put it to question that this House adopts the report of the Committee on County Public Accounts and Investment on the Auditor General's report on the examination of financial statements of Njoro Level 4 Hospital for the year ended 30th June 2022, laid on the table of the Assembly on Tuesday 15th April 2025 during the morning sitting. As many who are of that opinion say aye. As many who are of contrary opinion say nay. The ayes have it. Next order.
Mr. Speaker, sir, those are the orders of the morning sitting.
You all arise. Honorable members, this House is adjourned to today, 2:30 p.m. Thank you.